Hello everyone.
We
We are here after a total knee replacement.
Total knee replacement.
And this Dr. Nierenberg from Israel.
Right.
Operated my mom, and I first of all appreciate and grateful for his amazing work. Mom feels amazing, and I asked him about some tips for seniors, how basically to keep a healthy life. He's a huge expert in orthopedic field, and Dr. Nierenberg,
So,
what is yours?
there's nothing, this is not rocket science, but it's sometimes difficult to understand how important it is in an early time. Many of our understandings are latecomers. So to the early achievers, the simple fact is that physical activity, it doesn't have to be anything specific, but it has to become a way of life in order to prevent and solve and keep you alive and dynamic and mostly healthy for many, many years. But it has to be a way of life. You can't rely on bouts of activity. You can't be 26 and decide that this year I'm going to dedicate to activity, to physical activity or whatever. It doesn't even have to be any specific program or exercise treatment. Just something has to be done. You have to do something, whatever you feel like, whatever you hate the least, but just keep yourself in motion and do it very early. If you can start at the age of 6, it's guaranteed that every year you're going to pass with this kind of activity. You can rely that you're gaining years on the other end of life. That's first. Second, if you're at the 5th decade of life, or even earlier, try to think about being a vegetarian. It'll reduce your metabolic effort enormously, and there's no problem of compensating for what you lose by not eating meat, particularly red meat, and particularly in this cultural atmosphere that everything is happening in the kitchen or around food, and most of all meat by all its versions and kinds. So if you can give it up by the 5th decade of life or even earlier, it's a very sound recommendation. And then if you can be outside of building, outside of walls, outside of windows, if you can prevent yourself being in a closed environment, and try to be outside meaning at least some of the time not in a very busy city environment. That would be something that a promise of well invested time will return to you. I won't speak about the other aspects of how can you relax and how can you concentrate and how can you meditate and all that, because this is too far away from my understanding. But obviously there's a lot of disciplines and people who know about it and recommend it, and I cannot just have my opinion, but I do submit to whatever is recommended by these people. And if you're painful and if it's intermittent, if you have something insistent that bothers you, then apply to help. Don't try to be a hero. It's 2023, and the solutions are there. Even if it's something radical, surgery or whatever, don't hesitate. Of course, don't be reckless. But always find yourself somebody who sounds reasonable to you to recommend and to consult with, and keep yourself optimistic.
Wow, Thank you so much.
Good.
Thank you for your tips. Wow, we're so grateful. Thank you so much. Yeah.
Dr.
She's got a lot of work to.
Nierenberg, thank you very much. Super.
Good.